Welcome to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. As always, we will continue to bring you the latest real-world information and insights on healthcare, life sciences, and wellness in the Middle East region. This week's review will discuss a variety of countries in the Middle East and the relevant developments across public health, digital innovation, healthcare systems, disease surveillance, and the impact of regional situations on health system functionality. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to the 1st of May 2025. As always, our information is drawn from regional health ministries, institutions, advanced data, and news outlets coupled with our internal data gathering platform, HealthConnect Middle East. United Arab Emirates, UAE. The UAE continued its focus on advanced medical technologies this week. News outlets reported on growing investments in robotic surgery and AI-driven diagnostics within both public and private hospitals. The Ministry of Health and Prevention, MOHAP, also announced a new public awareness campaign focused on early detection of cardiovascular disease, a significant health concern in the region. Further details on the campaign's scope and implementation are forthcoming. Saudi Arabia. Saudi Arabia hosted Italy's Minister of Health for a visit to the King Faisal Specialist Hospital and Research Center, signaling continued international collaboration in healthcare. Additionally, Bayer signed an agreement for a skincare health project, indicating a growing focus on specialized healthcare initiatives. Local news also highlighted the kingdom's efforts to expand telehealth services, especially in rural areas, through investments in digital infrastructure and training programs for healthcare professionals. Egypt. Egypt strengthened its health cooperation with Kenya this week, focusing on knowledge exchange and capacity building in various health domains. Further details about the specifics of this collaboration are expected from the Egyptian Ministry of Health and Population. Iraq. The shipment of cancer medication from Iraq to Libya caused a political shake-up in Libya, with the Libyan Prime Minister dismissing the acting health minister. The incident highlights the complexities of cross-border pharmaceutical regulations and supply chains within the region. Palestine. Concerns over the health crisis in Israeli prisons were raised by Palestinian prisoner groups in an appeal to the World Health Organization, WHO, emphasizing the need for improved healthcare access and conditions for detainees. Libya. The dismissal of the acting health minister over the Iraqi cancer drug import underlines the challenges Libya faces in regulating its pharmaceutical sector. This incident could potentially impact access to essential medicines and necessitates a review of existing import procedures and regulations within the Ministry of Health. Regional summary. This week's health landscape in the Middle East region saw a mix of advancements in medical technology, regional cooperation, and ongoing challenges. The UAE's focus on integrating advanced technologies into its healthcare system continues to drive innovation in the region. Saudi Arabia's hosting of the Italian Minister of Health and the Skincare Health Project Agreement showcased the kingdom's growing emphasis on specialized care and international partnerships. The incident involving the Iraqi cancer drug shipment to Libya and subsequent ministerial dismissal highlights the fragility of pharmaceutical supply chains and the need for stronger regulatory frameworks within the region. The enhanced cooperation between Egypt and Kenya signals a positive trend towards regional health collaboration and capacity building. Moving forward, continued investment in health infrastructure, particularly in digital health technologies, and stronger regional partnerships are crucial for improving healthcare access and addressing persistent health challenges across the Middle East region. Continued monitoring of the situation in Libya is warranted to assess the impact of the recent political developments on the country's healthcare system. The WHO's warning about the risk of sustained community transmission of mpox in Africa, though not specifically MENA-focused, merits attention and necessitates preparedness measures across the region to prevent potential outbreaks. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.